the length of the cartilage is gonna keep on growing and growing and so on. So again, to sum up, appositional growth is the potential and the first stage of the growth, which is from the chondrogenic layer. We have the chondroblast, the movement of the chondroblast to the center. This until this position, this process is called the appositional, and controls again the thickness. And the moment that we have this chondrocyte start to mitotically divide and produce ECM, this is going to start elongating the length of the cartilage, and this is the interstitial growth. So this is important. Why do we care so much about growth of the cartilage, and why does the cartilage have to grow both in thickness and in length? Because in fact all of the embryonic skeleton is made out of cartilage. There is no true bone in the embryonic phase. It's only cartilage. All the long bones, all the bones in the human body during the embryo phase are just cartilage. After some time, this cartilage will undergo many changes and become bone. This is a topic that we'll discuss in the next week in the bone. But so far, we should actually understand that the joint, the cartilage is our first form of skeleton. So this is everything about hyaline cartilage. To sum up fast, we saw that the hyaline cartilage is the most resistant type of cartilage in the human body. The locations that we find this hyaline cartilage are literally numerous. The ribs, very importantly, in all of the respiratory system, is supported and structured with this hyaline cartilage. The ends of the joints, the articular surfaces, are practically contain cartilage, and this is and the cartilage right there, the hyaline cartilage, functions as a shock absorber, and very importantly, also it plays a very, very big role in the length of the bone itself. We'll discuss how this happens and how does the cartilage actually control a very, very big portion of the size of the long bone in the next practical when we see the ossifications. So we saw the components, again the typical components: glucosaminoglycans, glycoproteins and protoglycans, and very, very importantly, very high amount of water. We're talking about 60 to 80%, and this high content of water is one of the reasons why this cartilage is also resilient to and doesn't distort permanently. We talked about how the ECM works perfectly with the cells, and how the chondronectins, which is the multi-hexyl glycoproteins, control the relationships between the ECM and the cell, and the locations and the organization. And because of the chondronectin, we have this is one of the many reasons why the isogenous groups are so specifically located, so tightly controlled, and the distances and the relationship between the one isogenous group to the other is also directly related to the ECM, what contains collagen type 2 and the high amounts of the other types of the ECM, the amorphous ground substance that we discussed. The perfect example of the hyaline cartilage that we saw in the microscope was in the trachea, and we saw how we can identify the trachea with four actually things that are easy to see. First, we see the epithelium. The number one step to see and to identify all type of tissues is the epithelium. The epithelium is going to give you a lot of information about this side, depending on the content, depending on the type of epithelium. For example, whenever we see keratinized epithelium, we think of an area that doesn't need to lose, that needs to prevent water loss. Ideal example, skin. This is why we have the skin. Non-keratinized, the moment you hear the term non-keratinized, you immediately should think of a wet area. This can be mouth, this can be upper part of esophagus, this can be vaginal canal, doesn't matter. The moment you have a wet area, you should the moment you see a non-keratinized epithelium, you should straight up directly think wet area. So the first thing that we see here in the epithelium is the respiratory epithelium, which is ciliated, pseudostratified columnar epithelium. This, because we have the cilia, the moment you see the cilia, you should directly think that this is a respiratory system, 100%. And the function is to move mucus away. So the first thing we saw is the epithelium, this unique respiratory epithelium. The second thing we'll see is the mucous glands. We saw these small cuboidal glands that produce continually mucus. That's the second thing. The third thing that you should see is the cartilage. The cartilage, again, the structure of the cartilage, the hyaline cartilage, is, let's say, easy to understand. Whenever you see the structure of this isogenous groups, many different clumps of chondrocytes tightly controlled and tightly present one to one another, and this very, very vivid and intense basophilic color, you should be able to identify that this is hyaline cartilage or elastic cartilage. Elastic cartilage, we'll see in a bit, it has similar morphology with minor differences. We'll discuss the difference in a bit. So far you have the respiratory epithelium, the mucous glands, and the cartilage in the center of the structure. Lastly, you should be able to, not now, after we do the practical of the muscles, you should be able to also see and identify the smooth muscle cell. Right now, we saw a very small sample of how to identify the smooth muscle cell based on the wavy appearance of the nucleus. So these four features are unique, let's say, to this gland, and this combination of these four features is nowhere else in the human body to be found. So the moment you see these four features, you should directly think that we are in the trachea because of these specific characteristics that we just discussed right now. So we discussed also about the perichondrium, about the two types of patterns, the appositional and interstitial, how the appositional controls the thickness and the interstitial controls the length of the cartilage. Let's move on to elastic cartilage. There are two very common locations of the elastic cartilage in the human body. Number one is the ear, the elastic cartilage of the ear, and the second, that very, very important in the human body, is the epiglottis. So the difference is, how do we distinguish elastic cartilage from hyaline cartilage? First off, elastic cartilage, as the name suggests, is way more elastic. How does this happen? How does this cartilage achieve this elasticity? Well, this is due to the fact that there is an increased amount of elastic fiber inside this cartilage. And again, it's not that easy to differentiate visually, histologically speaking, the elastic from the hyaline. There is one trick that sometimes helps, and well, this is one of the tricks that you should use. The difference is that we see different quantity of chondrocytes inside the isogenous group. Specifically, the isogenous group of the hyaline cartilage can contain up to 8 chondrocytes, and in the epiglottis, specifically, not only the epiglottis, all the elastic cartilage can contain up to 2 osteocytes within one lacrina. So the difference is, how to differentiate, is the number of the available chondrocytes inside the isogenous group. So let's see the picture of the epiglottis. So first up, the first step is, what you always do is focus on the epithelium. Always check the epithelium, what type of epithelium we have. So here we see, what type of epithelium is this? Non-keratinized. So we have stratified, squamous, non-keratinized epithelium. This tells you that we're directly in a wet area, 100%. So this is the first side of the epithelium. If we go to the other side, this is again non-keratinized. If we start observing it all of that, we follow simply the line of the epithelium. What is this epithelium? This is a columnar. When you see this elongated nucleus, this spherical, this sort of shape of nucleus, this is the elongated, the columnar cell. If you see a spherical like this is the cuboidal. And the moment you see a flat and small, this is the typical squamous. So here we see two different types of epithelia. We see the stratified squamous non-keratinized, which is in a wet area, and another one which is in the ciliated pseudostratified columnar epithelium. This is in the respiratory epithelium. So the moment you see these two epithelia together, the moment you see the non-keratinized and the respiratory epithelium, you should immediately think that we're in an area that connects both the oral mucosa, the esophageal mucosa, and the respiratory. This is the only location, the only organ in the human body that connects and combines and touches these two organs, these two systems, is the epiglottis. So this is the first giveaway, the first hint of how to identify the epiglottis. And to be honest, this is the most clear sign that you will see in a slide. The other option, of course, is whenever you actually analyze the structure in the tissue, you see simply, again, these are, what is this again? Let me zoom in. This are mucus glands again. So is there any difference between this, the mucus glands, and the hyaline so far, and the trachea? They both contain respiratory system, the respiratory epithelium, sorry, and mucus glands. That's not the differentiating point. The differentiating point is the epithelial, the upper part of the epithelium, the superior part of the epithelium, which is the non-keratinized. And the second giveaway, not as subtle as the first one, is the amount of cells in the isogenous group. Typically speaking, you should find isogenous groups, isogenous aggregates of up to 2 chondrocytes in this cartilage. I'll be 100% honest with you guys, sometimes it is not that easy. It's not that easy to count exactly how many cells you have inside the isogenous group, simply because you have an excessive amount of overlap. Overlapping is not helping us to really easily identify which is which. After some time, after seeing many slides and spending more time, it's going to become a bit easier. But in the beginning, as a beginner, it's the perfect tool to differentiate epiglottis from trachea is the epithelium. The epithelium, and as a second confirmation point, let's say, like a second criterion, is the amount of numbers, the amount of cells inside these isogenous groups. So these are the tricks. This is a trick of how to identify the elastic cartilage, specifically the epiglottis, from the trachea. This is the trick. Again, the difference is, of course, in the content of the elastic cartilage is also the high number of elastic fibers within the elastic cartilage. Hyaline cartilage does not contain elastic fibers. Only elastic cartilage contains elastic fibers. It allows us to see the fibers. So here we see this staining method here. This is the again, a very special method, Mason's trichromy. This stains elastic and collagen fibers. This is simply a section that allows us to see how many of these. There are some major different Orsin. This is the Orsin staining, actually. This is the stain I was talking about. This is the specific for elastic fibers specifically, and we see the amount. Also Verhoef's. We'll see the amount of elastic fibers within the elastic cartilage. Let's go back to the final part, the final piece of the cartilage, the fibrocartilage. We discussed and we said already that there are two locations, two common locations of this fibrocartilage in the human body. One is the intervertebral disc, and the other one is the pubic symphysis. The function of fibrocartilage is specifically way more designed to receive shock. It's the perfect shock absorber when it comes in terms of cartilage. So we have two different things that you should know about this structure. Is the where is it? Here the morphology is a bit different. Specifically, the morphology of the fibrocartilage is instead of the typical isogenous groups that we had, which were, we have the typical isogenous groups that were in a circle, spherically shaped and spherically located in the cartilage, which was enclosed in a specific space. Here the fibrocartilage is a bit different. Here we have rows. Instead of groups, spherical groups, we have rows of chondrocytes. So the morphology again is the same. Let's zoom in the structure. Where is it? Here we find actually the fibrocartilage is a mixture of connective tissue and cartilage nonetheless. So within this section we will see mixtures of fibroblasts producing collagen types, collagen type 1, collagen type 2 as the part of the the connective tissue, and the chondrocytes themselves produce type of collagen type 1. So when we zoom in, let's zoom in a bit more. For example, this section shows us the typical morphology of what is this cell? What cell is this tiny nucleus here? This is a fibrocyte. This is the chondrocyte. This typical empty looking cytoplasm, this is typically found in chondroblasts and chondrocytes. So it is actually very, very easy to differentiate between the fibroblast and the chondroblast. So here we find the typical example in this section. We find the typical example of the rows of the chondrocytes. And in comparison, we saw, let me the chondrocyte here. Look at the morphology of the cartilage in the hyaline cartilage in the, this is the hyaline cartilage in the trachea, and this is the morphology of the hyaline cartilage of the fibrocartilage within the intervertebral disc. Majorly different, but they share the common feature, the common characteristic of the morphology of the chondrocyte. What is also interesting to notice is that these cells have this fibrocartilage has no perichondrium. It is actually massively different. There is no presence of perichondrium within the fibrocartilage. And the function, of course, of the fibrocartilage is to purely function as a shock absorber and to simply withstand and resorb all of the mechanical pressure that is accumulated within the discs. Now, this table is found in Jonquera. This table practically clears out all the differences between the hyaline cartilage, elastic cartilage, and fibrocartilage. This table is actually one of the most important tables in this chapter. It's going to help you a lot to figure out how these differences work and how they have an effect within the functionality of this tissue. So specifically, let's talk a bit about them briefly. We saw some differences. We saw that in the hyaline cartilage and elastic cartilage, we have a typical type 2 collagen presence inside the cartilage. In the fibrocartilage, we have major areas of type collagen of one type of cartilage, of the type 1 collagen within the structure, within the intervertebral discs. The cells are practically the same in all three. We have again chondroblasts and chondrocytes. The difference is that because we have this mixture of the cartilage with the connective tissue, with the connective tissue within the fibrocartilage, in that fibrocartilage we find both chondrocytes and fibroblasts. Now, presence of perichondrium. We saw perichondrium being present within elastic and hyaline, but not in fibrocartilage. Differences between hyaline and elastic. Hyaline has up to 8 chondrocytes within one isogenous group, and elastic has typically up to 2 chondrocytes within the lacuna. And last difference that is also very, very important to identify is that we find the isogenous groups within the hyaline and elastic cartilage are circular, spherically shaped, and we find isogenous columns in the fibrocartilage. Actually, that's it for today, guys. That's what I wanted to discuss about the cartilage. We went out through all the different types of cartilages. We saw the common features in the beginning. We saw the specific unique features of hyaline cartilage. Then we discussed about the elastic. Elastic is very similar to hyaline with minor differences. And the fibrocartilage, which is a very unique and its own type of cartilage. It has actually no resemblance to the other types of cartilage besides some kind of type 2 collagen and, of course, the chondrocytes nonetheless.